of the inaugural scientific sessions of Sri Lanka College of Specialist Family Physicians. And we are about to commence the ceremonial procession, and I kindly request all of you to rise as the ceremonial procession reaches the hall. Ladies and gentlemen, the ceremonial procession of the induction of the President and inauguration of the inaugural scientific session of Sri Lanka College of Specialist Family Physicians. This year's theme being Primary Care Resilience in Challenging Economies, a Way Forward to Universal Health Coverage.
Ladies and gentlemen, please rise for the national anthem.
Sri Lanka Mata, Abba Sri Lanka, Namo 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 Mata. Sundara Siddharani, Surani Ati Somamanalanuha.
Thank you, ladies and gentlemen. It is our honor and privilege to welcome each and every one of you on behalf of the President and the Council of the Sri Lanka College of Specialist Family Physicians to witness the induction of the President of the College and the inauguration ceremony of the inaugural scientific sessions. Ladies and gentlemen, to begin with today's proceedings, we have the lighting of the traditional oil lamp, which culturally symbolizes the dispelling of the darkness of ignorance with the light of knowledge. To do the honors, may I now call upon the following dignitaries. His Lordship, Chief Justice 𝓟𝓻𝓮𝓼𝓲𝓭𝓮𝓷𝓽, our Chief Guest today, Honorable Minister of Health and Industries, Dr. Ramesh Pathirana, Honorable Minister of Education and Leader of the House of Parliament, Dr. Susil Premjayantha, Honorable 𝓚ජරාභේවර්ධන, Member of Parliament, Sri Lanka, former Minister of Home Affairs and Public Administration, and Honorable Jayantha Veerasinghe, Member of Parliament, Sri Lanka, Dr. Sunil Dialvis, Acting Secretary and Additional Secretary, Medical Services, Ministry of Health, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽, Director General of Health Services, Ministry of Health, Professor K. Moana, Keynote Speaker, Professor of Value-Based Health Professions Education at University of Worcester, Dr. Malkanthi Galhena, President, Sri Lanka College of Specialist Family Physicians, and also Dr. Deepika Attigala, Senior Health Specialist, World Bank, accompanied with Dr. Kumari Navaratne, Country Representative, Asian Development Bank.
And with great pleasure, I also invite following dignitaries, Dr. G. Vijay Surya, Deputy Director General, Medical Services to Ministry of Health, Deputy Director General, Laboratory Services, Dr. Siddharth Dharmaratne, Dr. Champika Wickramasinghe, Deputy Director General, Non-Communicable Diseases, Dr. Samidhi Samarakon, Deputy Director General of Education, Training and Research, and Dr. Samantha Ranasinghe, Director, Primary Care Services, Ministry of Health, Dr. Lalantha Senaratne, Past President, Sri Lanka Association of Specialist Family Physicians, Dr. P. Halambarattige, Secretary, Sri Lanka College of Specialist Family Physicians, Dr. Clement Perra, Treasurer, Sri Lanka College of Specialist Family Physicians, a representative from the Council of the Sri Lanka College of Specialist Family Physicians, and representing other professional colleges, Dr. Chandrika Ponna Peruma, President of the Sri Lanka College of Cardiologists, and Dr. Kapila Bandhutilaka, President, Sri Lanka College of Ophthalmologists.
And also representing the collective of medical officers, may I now invite Dr. Haritha Aludge, Secretary to GMOA, to join the lighting of oil lamp.
And also DIG Roshan Rajapaksa also to come forward to light the oil lamp traditionally.
Thank you. Let me now invite the following dignitaries to take their seats at the head table. Our chief guest today, Honorable Minister of Health, Dr. Ramesh Pattirana. Our keynote speaker, Professor K. Moana, Professor of Value-Based Health Professions Education at University of Worcester. Past President, Sri Lanka Association of Specialist Family Physicians, Dr. Lalantha Senaratne. Inaugurative President, Sri Lanka College of Specialist Family Physicians, Dr. Malkanthi Galhena. Secretary, Sri Lanka College of Specialist Family Physicians, Dr. P. 𝓘𝓷𝓪𝓭𝓮𝓷𝓽. Treasurer, Sri Lanka College of Specialist Family Physicians, Dr. 𝓘𝓷𝓪𝓾𝓬𝓷𝓷.
Well, once again, a great evening to all of you as we are about to commence the sessions. And with great pleasure, I invite Dr. Lalantha Senaratne, the President of the Sri Lanka Association of Specialist Family Physicians, to welcome this distinguished gathering and for the opening remarks. Madam, over to you.
Good evening, distinguished guests and esteemed members present here. Today, we gather for a momentous occasion marking the President's induction and the inauguration of the scientific session of the Sri Lanka College of Specialist Family Physicians. This day is not just a celebration of the present, but also a reflection on the remarkable journey that has brought us to this significant point. I am truly honored to have the opportunity to address you today, reflecting on the dedication and perseverance of our esteemed college members that have brought us to this moment. It's my great pleasure to warmly welcome His Lordship, Chief Justice of Democratic Socialist Republic of Sri Lanka, Mr. 𝓘𝓷𝓭𝓮𝓷𝓽 Jayasuriya, to the inaugural scientific session of our college. Thank you, sir, for your graciously accepting our invitation and to be with us in this evening. A special welcome is extended to our chief guest, Dr. Ramesh Pattirana, the Honorable Minister of Health. Sir, your presence tonight is an immense honor, and we are grateful for your time amidst your busy schedules. Thank you for accepting our invitation and gracing this precious day with your presence. It is great honor to welcome Honorable Minister of Education and Leader of the House of Parliament, Dr. Susil Premajayantha, and Honorable Parliamentarians, Honorable Jayant Veerasinghe and Honorable Vajira Abeyawardena. Your valuable presence is a great honor to our college in this precious day. I would also like to acknowledge and welcome Dr. 𝓘𝓷𝓪𝓼, Additional Secretary, Medical Services, as well as the Acting Secretary. Your presence adds significance to this occasion, and we appreciate the guidance you provide as we strive to contribute specialized services to primary care in the field of family medicine. I'm delighted to extend a warm welcome to everyone present this evening, with special regards to our distinguished guest of honor, Dr. Alaka Singh, a figure of substantial recognition. Her role as a country representative of World Health Organization precedes her, making her presence among us a tremendous honor. A special welcome to Dr. Deepika Artikala, Senior Health Specialist from the World Bank. Her reputation precedes her, and we are honored to have such distinguished figure, and your presence adds a great significance to our celebration. Your continuous support and collaboration are vital for the success of our endeavors in the primary care. I warmly welcome Dr. Kumari Navaratne from Asian Development Bank, represents Sri Lanka, to witness this memorable occasion. I would like to express our sincerest gratitude to Professor K. Moana, the International Advisor on Primary Care, Royal College of General Practitioners, for graciously accepting our invitation to serve as the keynote speaker for this momentous occasion. Your willingness to share your expertise is deeply appreciated and highly valued. Your significant contributions to postgraduate training in family medicine are truly appreciated, and your part as a role model, mentor, exceptional supervisor, and examiner within our postgraduate program in family medicine are truly recognized and admired. I would like to take this moment to extend my most cordial greetings to all respected members present from the Ministry of Health, whose collective efforts have contributed to the splendor of this event. I extend my deepest gratitude to the Director General of Health Services, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽, whose unwavering guidance has been instrumental in the continual advancement of primary care in Sri Lanka. A heartfelt welcome is extended to Dr. G. Vijayasurya, DDG MS2, and Dr. Samantha Ranasinghe, Director of Primary Care, and all other directors from Ministry of Health. Your valued presence serves as a profound honor to this occasion. It is incumbent upon me, on behalf of the college, to express our sincere appreciation for providing the encouragement and opportunities that have fortified the realm of primary care in Sri Lanka. It is indeed a distinct honor to welcome the Emeritus Professor Nandini De Silva to this esteemed gathering. I wish to express profound gratitude for your remarkable contributions to the field of family medicine. Your contribution to family medicine have laid the foundation for our learning, and we are honored to have you with us today. We are honored by the presence of distinguished presidents from other professional colleges and colleagues consultants from other disciplines. Your collaboration and shared commitment to healthcare excellence are highly valued. Before I conclude, let's take a moment to delve into the history that has shaped the landscape of family medicine in Sri Lanka. The past few years have been pivotal for its development. In November 2017, family medicine was listed as the 6th clinical discipline in the minimum standards of medical education. Turning the pages of history, the roots of family medicine as a postgraduate course in Sri Lanka can be traced back to 1981, when the first training program for the diploma in family medicine was established. The MD program began as MD by thesis in late 80s, initially limited to universities and private sector candidates who engaged in full-time general practice. Later, in 2000, the MD family medicine by clinical training was established and expanded to include Ministry of Health candidates in 2009. The MD family medicine by clinical training was established and it's to the Ministry of Health, and it's a milestone, and I am fortunate to have been a part of the inaugural batch. The pioneering batch of board-certified consultants in family medicine commenced service within the Ministry of Health in 2014. The Sri Lanka College of Specialists in Family Physicians began as a fledgling association with a mere 10 participants. As the founding president, as well as the immediate past president, I am witnessing the remarkable development of its association as a college with a thriving community of more than 100 members in the year 2023. Our aim is to provide proper guidance and training to postgraduate trainees in family medicine by conducting continuous clinical and academic programs, while improving the contribution from family medicine to Ministry of Health to improve healthcare services delivery in Sri Lanka. Our role as specialists in family medicine is unique. We embrace the responsibility of caring for all patients, irrespective of their age, gender, or reason for encounter. Trained as resource managers, we play a pivotal role in providing cost-effective care, a crucial factor in today's context. The heart of our discipline lies in the doctor-patient relationship, and we are adept at providing care from the womb to the tomb. With the escalating burden of non-communicable diseases, the demand for trained primary care physicians in our country has surged. Today, we stand united, ready to meet this demand and continue our journey of contributing to the health and well-being of the nation. I take immense pride as the past president of the college to declare that we have reached the pinnacle of our expedition this year with the marking of inaugural academic sessions. This year, the theme of the Congress is Primary Care Resilience in Challenging Economies, a way forward to universal health coverage. The prevailing socio-economic crisis of our country has led to a dire need for humanitarian assistance, thus drawing attention to our college in the deliverance of cost-effective, quality health care to all, and provide strength to improve the health delivery system in our country. Once more, I extend my heartfelt gratitude to each of you for gracing us with your presence on this momentous day. Your attendance holds immense significance, and we eagerly anticipate the invaluable insights and contributions that are poised to elevate the caliber of our scientific session. Thank you. Your presence. Let's work together to drive innovative healthcare advancement of our country. Thank you.
Thank you very much, Madam, for those wonderful thoughts you shared, and also for welcoming all of us for these inaugural sessions. And moving on, ladies and gentlemen, we are moving on to the entertainment act, which is a puja dance, next by the Ranga Silva Dance Academy.
සේදමාවත දිගේ කෙම් බිමට දොර හැර තිබේ මේ මංමාවත් දිගේ මුණ ගැසෙන නව යුගයේ අපි ඉන්නේ සේදමාවත දිගේ කෙම් බිමට දොර හැර තිබේ මේ මංමාවත් දිගේ මුණ ගැහෙන නව යුගයේ අපි ඉන්නේ සුවඳයි අපේ සුවඳයි මේ එන්නේ ගාන මුහුදු වගේ මේ යෝධ
සාන ගල් කුළු පුරා සරුසාර අස්වනු සදා
බෝ ආයු පුදනා තුරා සැක නැතුවයි බය නැතුවයි ඉන්නේ
සීසාන ගල් කුළු පුරා නිති සරුසාර අස්වනු සදා බෝ ආයු පුදනා තුරා සැක නැතුවයි බය නැතුවයි ඉන්නේ
අපි ගැන ලෝකෙම අපි ගැන අපිටම උදම හිතේවි සත්වකින්ම අද සෝභාගාමේ සැබෑ ලස්සන ලබා දුන්නට විඳගන්න
ඔබගේ පපුතුරේ කිරෙනි පනරැවි ඔටුනු හිසදැරු අපි ඔබේ දරුගෝ ලොවේ කොයි වෙතත් රැඳී ගයනිවා සදා ඔබේ අගේ
சீரகை விரித்து கொண்டோம் உயர உயர செல்லும் உலகம் வியக்குனாம் ஒரு தாய் மக்கள் இயற்கை எம்பளம் உழைப்பு எங்கள் பலம் சிகரம் இலங்கையே
We are one nation, one family, resembling togetherness. That was 𝓟𝓻𝓮𝓷𝓼 Dance Academy to you, ladies and gentlemen. And next, we are moving on to one of the most important occasions of the night. That is the induction of the President of Sri Lanka College of Specialist Family Physicians. And to do the honors, we would like to invite the outgoing President, Dr. Lalantha Senaratne, to formally introduce the President and to read the citation of the incoming President. Madam.
Good evening again. Dr. Malkanthi Galhena, inducting President of the Sri Lanka College of Specialist Family Physicians, to this exciting audience. Dr. Malkanthi Galhena is board certified consultant family physicians, currently working at Base Hospital, 𝓘𝓷𝓪𝓾𝓬𝓷. She was awarded the MBBS degree from the University of 𝓘𝓷𝓪𝓾𝓬 in 1993. She is a proud product of Central College Maho and Kegol Balika Vidyalaya with dedication for studies, sports and other extracurricular activities. She commenced her professional journey as an intern medical officer at Colombo South Teaching Hospital and has served in several hospitals since then by taking various responsibilities. She commenced her internship as MOPD at General Hospital, 𝓘𝓷𝓪, and this was her first experience of working as a primary care health provider. After completing 1-year post-internship, she got her appointment to Colombo South Teaching Hospital as SHO Medicine and Resident House Officer Accident Service. She took this opportunity to improve and shape her clinical skills in safe patient care. She commenced duty as a medical officer in the police hospital Narahempita in 2000, where she had to engage many issues related to primary care. She delivered a valuable service to the police hospital until 2007. In 2007, she decided to do her postgraduate studies in family medicine and consequently obtained the diploma in family medicine from University of Colombo. With this postgraduate qualification, she joined to the Family Practice Center in the Department of Family Medicine in the University of 𝓘𝓷𝓭𝓮𝓷𝓽 as a family physician when she opted family medicine as her career choice. She has obtained her MD in family medicine from the Postgraduate Institute of Medicine, University of Colombo, and successfully completed her post-MD overseas training in the United Kingdom under the guidance of Professor K. Mohana. She contributed her service as an examiner for undergraduate and postgraduate examinations conducted by the University of Colombo and University of 𝓘𝓷𝓪𝓾𝓬𝓷, an examiner in MRCGP South Asia conducted by Royal College of General Practitioners, UK since 2013. She is a visiting lecturer in the Faculty of Medical Sciences, University of 𝓘𝓷𝓪𝓾𝓬𝓷 and Postgraduate Institute of Medicine, University of Colombo. She is a trainer, an examiner, and a research supervisor for postgraduate training in family medicine. She is a life member of Sri Lanka Medical Association, member of the College of General Practitioners, member of the Royal College of General Practitioners, as well as a member of the Board of Management, Postgraduate Institute of Medicine, Colombo. She was the head of the clinical team, which includes 600 medical professionals in home-based care for COVID-19 infected patients conducted by the Ministry of Health, Sri Lanka, with the guidance of World Health Organization. She is a resource person of island-wide primary care capacity building program for medical officers who delivers first contact care in state sector hospital. She also a resource person of the Directorate of Healthcare Quality Conduct, the Telemedicine Development Committee of the Health Informatics Unit in the Ministry of Health, Sri Lanka. Dr. Galhena provides her outstanding contribution as a module coordinator, Primary Care System Strengthening Project, PSSP project of the World Bank, and hold in the membership of the Advisory Committee of Continuous Professional Development in the Ministry of Health. National Primary Care Development Committee, Non-Communicable Disease Unit, as well as the Elderly Care Development Project in the Ministry of Finance. Dr. Malkanthi is married and blessed with 2 children, Hasiti and Vihan. And now, it's my great pleasure to propose the induction of our new president, Dr. Malkanthi Galhena. Dr. Galhena has been a pillar of strength and driving force in our college. Her passion for family medicine, dedication to well-being of our patients, and commitment to the advancement of our profession make her the ideal leader to the college. I have no doubt that under her guidance, our college will reach a new heights and continue to be a beacon of excellence in healthcare. Thank you.
Thank you very much, Madam. And I now cordially invite Dr. Malkanthi Galhena, our inaugural president of the Sri Lanka College of Specialist Family Physicians, on stage to give her oath and to receive her presidential medal. And I also kindly request the president to give away the past president's medal to Dr. Lalantha Senaratne. Thank you very much.
Next is the moment we all have been waiting for. It is my privilege and honor to call upon the inaugurative president, Dr. Malkanthi Galhena, consultant specialist family physician, to deliver the presidential address. Over to you, madam.
Good evening to all of you. Chief Justice of Sri Lanka, His Lord Jayanth Jayasuriya, Chief Guest, Dr. Ramesh Pathirana, Honorable Minister of Health and Industries, Sri Lanka. Our keynote speaker today, Professor K. Mohana, International Advisor for the Primary Care Development in Southeast Asia region, Royal College of General Practitioners, United Kingdom. Our guest of honor, Dr. Alaka Singh. She unfortunately faced to her daughter's medical issue. Because of that, she informed us that she couldn't attend to this forum today. Then outgoing President of Associations of Specialist Family Physicians of Sri Lanka, Dr. Lalantha Senaratne, Secretary of Sri Lanka College of Specialist Family Physician, Dr. 𝓘𝓷𝓪𝓾𝓬𝓷. Council members, members of all the colleges, Additional Secretary of the Ministry of Health, Dr. 𝓘𝓷𝓪𝓷𝓷. Director General of Health Service, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽. All the Deputy Director Generals, Dr. G. Vijayasuriya, Deputy Director General of Primary Care Services, and all other Deputy Director Generals of the Ministry of Health, Presidents of all other professional colleges and members, all consultants, all senior registrars, registrars and medical officers, distinguished invitees, ladies and gentlemen. My apologies that I have to welcome, first of all, the Parliament members, Honorable 𝓘𝓷𝓪 𝓭𝓮𝓷𝓽, Member of the Parliament, former Minister of Public Administration and Home Affairs, Dr. Mr. 𝓘𝓷𝓪𝓭𝓮𝓷𝓪 Veerasinghe, Member of Parliament and the President Council, our Senior Minister, Dr. 𝓢𝓬𝓲𝓭𝓾𝓬𝓷𝓀, Minister of Education and Higher Education. Again, apologies for missing your names in front. And I would like to, thank you for you all for being with me today, this evening, to grace this occasion. It's an honor and privilege to address this prestigious gathering for the inauguration of the scientific session and induction ceremony of the President of Sri Lanka College of Specialist Family Physicians 2023. Dear colleagues, I am deeply humble and grateful for the trust and confidence you have placed on me by electing me as the first president of this esteemed college. I accept this role with utmost humility and dedication. Before I proceed, let us take a moment to acknowledge and commend the visionary leadership of our President of Sri Lanka Association of Family Physicians, Dr. Lalantha Senaratne. Her dedication and pioneering spirit ignited the flame that led to the transformation of the association into this college today. Dr. Senaratne's unwavering commitment to advancing family medicine in Sri Lanka has set the stage for our growth and influence in the medical field. I am grateful for the opportunity to continue her noble work and pledge to carry it forward to the best of my abilities. Sri Lanka's health per capita expenditure is $161. The government spending on the public health sector is 1.6% of the GDP. Despite of having low budgetary provision for the health sector, our health indices are in par with developed countries. This was achieved due to a strong public health system and low-cost curative care services. However, the recent economic crisis in Sri Lanka has strained national budget. Push towards large borrowing leads to increased income irregularity and economic uncertainty. This affected all sectors of the country, including the health sector, badly. Due to this fact, most of decision makers started give more focus on primary care strengthening as a solution. Globally, the development of primary care system has been proved that it's an investment for a country. So we are, as a developing country too, has taken the right pathway to follow the same strategies to help the country's current economy by giving immense priority to strengthen the prevailing primary health care system. We, as a college of expertise in primary care, are accountable in implementation of strategies to strengthen the system with relevant health authorities. I wanted to present some key points that our college can work with the Ministry of Health to stabilize the health sector while keeping the quality of service at this economic crisis. As per the annual health bulletin of the Ministry of Health, each year, each citizen of this country has visited outpatient services more than 3 times. Annual attendance of OPDs of state sector hospitals is nearly 59 million. The OPD has been recognized as the primary care setting in the state sector hospitals in our country. But these services are mostly unsupervised by primary care specialists compared to the developed countries. This could be supervised and streamlined to the standard primary care practice. This could be supervised and streamlined to reduce morbidity and repeated hospital visits, aligning with the standard primary care practice worldwide. Also, the same document denotes that the percentage of elderly population has almost doubled during the period from year 1981 to 2019. This necessitates the early detection of diseases to prevent unwanted hospitalization, increase health cost, and burden to the family and the country. Hence, supervision of these services will strengthen the prevailing system. Very recently, World Health Organization Director General Dr. 𝓘𝓷𝓪𝓾𝓬𝓷 said, I quote, around 90% of essential health services can be delivered through primary health care. On the ground, in communities, via health professionals, doctors, nurses, and in local clinics. The broad spectrum of services that primary health care provides can promote health and prevent diseases, avoid and delay the needs for more costly secondary and tertiary services, and deliver rehabilitation. Primary health care serves as the eyes and ears of a country's health system, reaching to the communities where people live. I unquote. Many health experts believe that investing to build resilient primary health care services will ensure countries in need to withstand the shocks of future health crises and safeguard communities and economies for the future. Also, primary care is a great investment for a high-performing health system. Research shows that greater use of primary care is associated with lower cost, higher patient satisfaction, fewer hospitalization, emergency department visits, and lower mortality. In fact, internationally, almost all developed countries have a higher ratio of primary care to specialty spending and enjoy lower cost and higher life expectancy. For an example, the Great Britain primary care services constitute 12% of overall healthcare spending. This serves as the source of 80% of all interactions between patients and the physicians. The leading researchers suggest that doubling primary care financing to 10 to 12% of total healthcare spending would be likely to pay for itself through resulting reduction in overall health spending. Furthermore, an importance of strengthened primary care system has been highlighted by the Asthana Declaration in 2018 by WHO. Ladies and gentlemen, as representatives of the College of Specialist Family Physicians, I am proud to share with you that impactful collaborations and initiatives that define our commitment to advancing healthcare in partnership with health authorities in Sri Lanka. Our noteworthy endeavor was our clinical leadership in home-based care system for COVID-19 patients during the year 2021 to 2022 during the pandemic. This pioneering program, conducted under the guidance of Director General of Health Services, showed the dedicated effort of specialist family physicians as leaders to 600 medical officers and pre-intern doctors. Together, we worked tirelessly to provide essential care and support to those affected by the pandemic, demonstrating our resilience and adaptability in the face of unprecedented challenges. Hence, we have served more than 100,000 of patients by giving home care at the verge of overwhelming of hospitals during the third wave of COVID-19. We are also serving as a resource person for the non-communicable disease unit of the Ministry of Health under the guidance of Dr. Champika Wickramasinghe, contributing to the formulation of guidelines that play a pivotal role in combating the growing health challenges posed by non-communicable diseases. Our collaboration extends to the Directorate of Primary Care, where we actively participate in designing and implementing nationwide capacity building programs. These initiatives conducted in collaboration with other professional colleges with the support of World Health Organization underscore our commitment to fostering a skilled and proficient healthcare workforce across various sectors. In our pursuit of knowledge sharing, we have embarked on online continuing professional development programs. These programs, focused on primary care settings in state sector hospitals, aim to address knowledge gaps among medical professionals and other members of the multidisciplinary team. Through this collaborative effort with other professional colleges, we are dedicated to ensuring the continuous improvement of patient care, emphasizing the importance of staying abreast of the latest advancement in primary care. Our involvement in the advisory committee of the Elderly Care Improvement Project, led by the Ministry of Finance, reflect our dedication to addressing the unique healthcare needs of the elderly population. By providing support and expertise, we contribute to the development and enhancement of initiatives that promote the well-being of our senior citizens. Our collaborations with the health authorities stand as the testament to the College of Family Physicians' unwavering commitment to the betterment of healthcare for our nation. Together, we navigate the ever-evolving landscape of healthcare, striving for excellence and ensuring that the well-being of our communities remains at the forefront of our collective mission. Ladies and gentlemen, our commitment to advancing healthcare aligns seamlessly with the mandates set forth in the new health policy and National Strategic Master Plan 2016-2025, which underscores the imperative efforts to fortify the primary care system of the country. The primary goal, as emphasized, to achieve universal health coverage by the year 2030 to all citizens of Sri Lanka. In recognition of our pivotal role in this transformative endeavor, the Ministry of Health has entrusted us with the monumental task of transitioning prevailing primary care services into a robust, resilient primary care system. This responsibility goes beyond the conventional scope of healthcare provision. It's a mandate to ensure accessibility, delivery of quality healthcare services, provide financial protection and external coverage with equity and equally to all citizens of our country. We are aware that accountability placed upon us to provide safe patient management at first contact care. It's our duty to furnish supervised and evidence-based management at outpatient departments, laying the foundation for resilience in healthcare. Through this, we aspire to decelerate the burden of non-communicable diseases, prevent inward overcrowding, proper elderly care, and curtail this escalating cost of health services. We are also in the verge of practicing telemedicine for caring at a distance with limited physical consultations as another strategy we are going to conduct in future. Our ultimate goal is to make network between Apex and the cluster hospitals to create empaneled population to each primary care settings as a prerequisite to deliver universal health coverage through which to provide safe patient-centered care for our people. Working collaboratively with the other specialists and members of multidisciplinary teams to enhance the integration of patient care, ensuring a holistic approach that addresses the diverse healthcare needs of our population. Collaborating with educational institutions to support increased postgraduate training opportunities in family medicine. This initiative is essential to meet the growing service demands necessary for the widespread implementation of universal health coverage across the entire island. As I stand before you today, my heart is filled with gratitude and a deep sense of appreciation for the incredible journey we have undertaken together in advancing the field of family medicine. This moment calls for reflection and sincere acknowledgement of those who have been instrumental in our shared success. First and foremost, I extend my heartfelt thanks to my beloved country, Sri Lanka. It is within the embrace of our nation's values and opportunities that I have been privileged to serve the noble cause of family medicine. The support and encouragement from the broader community have been the bedrock of our achievements, and for that I am truly grateful. To the dedicated school Vijayabha Central College Maho, Kegol Balika Vidyalaya, and university teachers, you are the architects of knowledge and wisdom, shaping the minds that will shape the future of healthcare. Your commitment to education has been a beacon guiding my path. Thank you for instilling in me the passion for continuous learning and the pursuit of excellence. Furthermore, University of Worcester, UK has further strengthened me with not only knowledge and skills, but also attitudes towards the better professional conduct. The Department of Health has been a crucial partner in our mission to enhance the health and well-being of our communities. Your collaboration and shared commitment to advancing healthcare have been invaluable. Together, we have worked tirelessly to build a healthier and more resilient society. To my esteemed college in the University of 𝓘𝓷𝓭𝓾𝓬𝓷 and the Department of Health, and colleagues of the other professional colleges, your unwavering dedication to the principles of family medicine has been both inspiring and motivating. Our collective efforts have pushed the boundaries of knowledge and practice, driving us towards new horizons in patient care and medical research in Sri Lanka. I extend my gratitude to the staff of my previous institutions whose tireless efforts have laid the foundation for the work we continue to do today. Your contribution have not gone unnoticed, and I am deeply appreciative of the support you provided. Special acknowledgement goes to the office bearers of the council of our college. Your leadership, guidance, collaborative spirit have been instrumental in steering our organization towards its goal. Together, we have fought a path of innovation and excellence in family medicine in Sri Lanka. To the young family physicians, you represent the future of our profession in Sri Lanka. Your enthusiasm, fresh perspectives, and the commitment to compassionate care are the driving forces behind the positive changes we aspire to bring the primary care focusing to the patient-centered management. I am confident that you will continue to uphold the principles of family medicine with the same dedication and passion that have characterized our journey thus far. Last, but certainly not least, I have expressed my deepest gratitude to my parents, my mother and my father, my husband, my daughter Hasiti, and my son Vihan, and my classmates, my batchmates, and my friends. Your unwavering support, love, and understanding had been my anchor throughout this remarkable journey. It's your encouragement that has energized me, my commitment through happiness to the betterment of healthcare, and for that I am eternally thankful to you all. As we look back in our shared accomplishment, let us also look forward to the challenges and opportunities that lie ahead. Together, as a united front, we will continue to make strides in the field of family medicine, leaving a lasting impact on the health and well-being of our communities. Thank you all of your unwavering support, collaboration, and dedication. Our collective achievements are the proof to what can accomplish, and we work together towards a common goal. May we continue to inspire and uplift each other in the pursuit of excellence in family medicine. Thank you very much, and all the very best.
Thank you very much, Madam, for that informative speech. And also, it's definitely going to be a glorious year this year for the Sri Lanka College of Specialist Family Physicians. And next, we have another important occasion, that is the address by the chief guest. And to read the introduction of the chief guest, I have great pleasure in inviting Dr. Manuri.
Thank you, Latif. Ladies and gentlemen, esteemed guests, it is my privilege and honor to introduce Dr. Ramesh Pathirana, a distinguished leader with decades of remarkable multidisciplinary experience in leadership and a career spanning in various domains, while showcasing his prowess in leadership, integrity, agility, and duty to state. As a product of Richmond College Galle and an alumni of Faculty of Medicine, University of 𝓘𝓷𝓭𝓾𝓬𝓷, he is a physician by profession and currently serves as an aspiring leader to the entire healthcare system. Dr. Ramesh Pathirana joined politics following the footsteps of his late father, Honorable Minister of Education, Mr. Richard Pathirana, who was a pioneer in reforming the education system of this country. He was elected to the Parliament of Sri Lanka in the year 2010 and has been serving under various administrations up to this date. His landslide victory in 2020 with highest preferential votes in the District of Galle is a no-date to his public service. With a vivid knowledge and reputation for excellence, Dr. Pathirana has held key positions in various parliamentary committees and commissions under many administrations. Dr. Pathirana's academic journey includes an MBBS from the prestigious University of 𝓘𝓷𝓪𝓾𝓬𝓷 and also a Master's in Business Administration, showcasing his commitment to professional excellence. As a seasoned professional with a wealth of experience and a commitment to continuous growth, Dr. Pathirana stands as an exemplar of transformational leadership of a physician in healthcare. Please join us in welcoming Dr. Ramesh Pathirana, Honorable Minister of Health and Industries, to stage. Over to you, Honorable Sir.
Good evening to all of you. Professor Malkanthi Galhena, President-elect, College of Specialist Family Physicians of Sri Lanka. Dr. Lalantha Senaratne, outgoing President of the College. Professor K. Mohana, keynote speaker today, and also members of the head table. Honorable 𝓘𝓷𝓭𝓮𝓷𝓽, Chief Justice of Sri Lanka. Honorable Dr. 𝓘𝓷𝓭𝓮𝓷𝓷, Minister of Education. Honorable Dr. 𝓘𝓷𝓪𝓾𝓰𝓾𝓻𝓪𝓽, Member of Parliament and former Minister. Honorable 𝓘𝓷𝓪𝓾𝓰𝓾𝓻𝓪𝓽, Member of Parliament, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽, Director General of Health Services, and Dr. Sunil Dalvis, Additional Secretary of the Health Services. Distinguished guests and my dear friends, let me at the outset thank the College of Specialist Family Physicians of Sri Lanka, having invited me to come here tonight at the time of their most important annual academic calendar, election of the president of the college, and also the academic sessions to be followed. And I congratulate Dr. Malkanthi Galhena for her election as the new president of the college, and also wish her good luck in her tenure as the chairman to uplift the Sri Lankan healthcare standards together with the other family physicians to greater heights. As explained, as all of us know, Sri Lankan healthcare system was evolving faster than any other sector of the country since we gained independence in 1948. Successive governments of the country have spent considerable sum of money to uplift the standards of the healthcare system. Parallel to the educational development of the country, now the benefits of such efforts have come to greater levels. Thanks to that, the Sri Lankan healthcare professionals have managed to bring the Sri Lankan health standards to newer heights. That's why the World Health Organization recognizes Sri Lanka as a country which provides better quality healthcare at affordable and lower costs. With that help, we've been managed to come to world levels in relation to some of the statistics, including maternal mortality rate, infant mortality rate, vaccine preventable diseases, and also importantly, we have managed to bring it up to a decent level in relation to life expectancy at birth. We record nearly 77 years now, which have come from 42 years at the time of gaining independence in 1948, which is a remarkable achievement. We should be able to bring it further up with the help of you all. As indicated by Dr. Galhena during her presentation, our disease burden has been transforming from one of communicable disease burden to that of non-communicable diseases. Even though we have been very successful in controlling these communicable diseases, we are faced with a heavy burden of non-communicable diseases today. The numbers of patients with hypertension, diabetes, cardiovascular disorders, heart diseases have been increasing rapidly over a period of time. So it's timely that all of us in the healthcare system interfere effectively with the help of the family physicians and also with the other medical professionals to ensure that we curtail such conditions from coming into endemic levels. With that, I think your support, the College of Family Physicians, have been strengthening the Sri Lankan primary healthcare services which would be the way forward. As indicated by Dr. Galhena, it's our duty to ensure that we provide more financial assets to the primary healthcare strengthening of the country. We've been very successful in a lot of conditions, we have been strengthening primary healthcare sector over a period of time, and also we have a world-class tertiary care service in the country, and this is a country where anybody and everyone can enter a hospital without having an identity card or without having a proper insurance scheme, and starting from a simple paracetamol tablet to a complex neurosurgery is performed without a single cent being charged from the patients of the country. There are many countries like that in the world. So we have been, over a period of time, have spent that money for the benefit of the people of the country. But since of late, we have been encountering few issues in relation to the financial constraints, the economic debacle we encountered last year. But even though there are a lot of criticisms in relation to the economic debacle that happened last year, at the same time we must ensure that there had been significant sum of money that had been spent for the infrastructure development, healthcare development, educational development, so on and so forth during last 5 to 6 years, during last 5 to 6 decades over a period of time. So it's never too late that we consider, with the support of many different organizations which have come forward to support the Sri Lankan healthcare system during last years, WHO, World Health Organization, the UNICEF, World Food Programme, and also the Asian Development Bank and World Bank, to name a few. We have the wherewithal to further strengthen Sri Lankan healthcare system to uplift standards. So without taking much time, I congratulate again, during the tenure of Dr. Mrs. Galhena, we should be able to see newer heights of the Sri Lankan College of Specialist Family Physicians, and with your efforts, and together all of us can take the Sri Lankan healthcare system to great heights for the benefit of the people of this country. Thank you very much and have a pleasant evening.
Thank you very much, sir, for gracing this event as the chief guest. We would now like to invite Professor K. Moana, Professor of Value-Based Health Profession Education at University of Worcester, to deliver the keynote speech. And I would like to invite Mr. Roshan Latif to read out the citations. Over to you, Roshan.
Thank you very much, Dr. Manuri, and what a great honor for me to introduce this special person who is our guest keynote speaker today. Professor K. Moana is a partner and trainer in general practice. She is a professor of value-based healthcare education at Worcester University, where she is the director of MBCHB program for the 3 counties medical school and the admissions tutor. She is working to introduce principles of sustainability and social accountability into the undergraduate curriculum for future doctors. Professor K has a doctorate in education from University College London and is a National Teaching Fellow of the United Kingdom Higher Education Academy. She was the RCGP International Development Advisor for South Asia for 8 years and now is the International Development Advisor for Cyprus. Professor K is in the editorial board of Education for Primary Care, and she was a National Council member of RCGP, the Royal College of General Practitioners, and also a General Medical Council PLAB examiner. Professor Mohana sits as chair of the Medical Education Subcommittee of the Charity Doctors Worldwide and was part of the educator team in the Rohingya refugee camps living and working in Cox's Bazar. Professor K has authored and co-authored 13 books and is the author of the Royal College of General Practitioners e-learning module on allyship. Ladies and gentlemen, with great pleasure, I give you Professor K. Mohana.
Thank you very much for those kind words. Distinguished guests on the dais and in the auditorium, Madam President, Lords, ladies and gentlemen, dear friends and colleagues, and registrars and trainees in family medicine, it's a very great privilege to be here. I'm thrilled to be here on the occasion of my dear friend's inauguration, but honoured to be invited to speak to you. I think I'm the last one before your dinner, so I'm aware of that responsibility not to talk for too long. If I disappear very suddenly, it's because I've fallen off the back. It's my very great privilege to kick off the scientific portion of your conference. And I would like to talk on the main theme, the primary care resilience that's needed in challenging economies. and how that can be a way forward for universal health coverage. So this is where Worcester is. Some of you may have heard of Worcestershire sauce. It's made in Worcester. This is my new medical school. Our very first batch are 10 weeks into their medical career. So that's a very great responsibility and privilege that I'm learning from my students every day. So I'm going to talk about some of the evidence that President Galhena has already mentioned about the strength of primary care being important for the development of universal healthcare coverage. I'm going to talk a little bit about the challenge of achieving UHC, and with your permission, pose maybe 5 areas that are key elements to consider to strengthen UHC provision. I don't need, perhaps, in the presence of this distinguished audience, to remind each other of the definition of universal health coverage. It's set out in the United Nations Sustainability Development Goals under number 3, paragraph 3.8. And as we have already heard, it is the aspiration to provide all people with access to essential, high-quality health services that are safe, effective, and affordable, such as medicines and vaccines, which do not leave them impoverished trying to achieve those coverages. So ensuring financial risk protection is an important element of UHC by providing care regardless of a person's ability to pay for it at the point of care. It's important to think about the challenges to UHC because after the pandemic, now more than ever, the world is in difficulties. So if we go back to 2018, within South Asia, 49% of the population was not covered by universal health coverage at that time. And it's only got worse. Worldwide, I couldn't find the broken down figures for South Asia because I think time is needed to collate those figures. But the worldwide figure has dropped to only 39% of the population of the world being covered by universal access. We've seen a resurgence of TB, both cases and deaths. We've seen disruption to food, global security, and we've seen disruption to maternity care and reduced uptakes of vaccines throughout the world, directly attributable to the COVID pandemic. In my country, in the UK, vaccine uptake is down 30%, 30%. And we are seeing a resurgence in measles, for example, because of lack of coverage of vaccines. We see geopolitical uncertainties, inflation, rising costs of borrowing, and risks of sovereign default, government risk level. But we know from the literature that primary healthcare improves the performance of health systems by lowering overall healthcare expenditure whilst improving population health and access. It sounds impossible that costs should go down when quality and access goes up. And I'll just review the evidence for why that is, but I would also recommend this paper to you. Michael Kidd, you'll appreciate, was previous president of WONCA, a very important paper looking at why strengthening primary healthcare in particular is essential to achieving universal health coverage. So the literature starts with the work of Barbara Starfield, who devised a system for measuring the quality or the strength of primary care in a country. And by strength, she means the degree of comprehensiveness of primary care, i.e. the extent to which primary care practitioners treat rather than refer. So we don't just see and signpost, we manage. And in the UK, we see and treat up to 90% of the patients that we see, and we refer in just 10%. So the degree of comprehensiveness is the first measure of strength. And the second is family orientation, the degree to which services are provided by to all family members by the same doctor. And they worked out a way of measuring that across lots of different systems to look at the impact. And they found the evidence for the benefits of strong primary care orientated health systems is robust wherever you look, internationally, at population studies within countries, across areas with different primary care physician to population ratios, at studies where people go to different types of practitioners, all show benefits. And if you look at clinical studies of people going to facilities or practitioners who differ in their adherence to the primary care principles, you have poorer outcomes. And the thing is, those benefits come at a less cost. Primary healthcare, when it's strong, delivers measurable better health outcomes. It delivers lower all-cause mortality. It delivers mortality that's lower from asthma and emphysema, from bronchitis and pneumonia, so chronic and acute respiratory conditions. It lowers mortality from cardiovascular disease, even after you control for income inequality and the major socioeconomic differences associated with health. Even after you control and take into account socioeconomic difficulties, strong primary care reduces mortality. And it goes on. Primary care orientated countries have lower numbers of low birth weight infants. They see lower infant mortality, especially in the post-neonatal period. There are fewer years of life lost to suicide. And there's higher life expectancy in all age groups, except for those who have already achieved 80. And these are measurable, demonstrable facts about healthcare systems that have strong primary care. These two graphs are very interesting. The red graph shows the reduction in predicted years of life lost in low primary care strength countries. So the red line is those with weaker primary care, but you can see that over time, as years go by, the predicted number of years of life lost is going down. It's encouraging. But look what's happening in the blue line, the high primary care countries. It's lower to start with, and two lines are diverging. Strong primary care countries are getting better, and in fact, terrifyingly, at the end of the graphs, they start to diverge very strongly. Strong primary care countries are doing better, weak primary care countries are doing worse. And if you look at it from the perspective not just of income required to run this sort of health service, but look at the inequalities, areas with better primary healthcare services also have fewer disparities in health between socially advantaged and socially disadvantaged sectors of the same population. Strong primary care reduces inequalities. Improvements in health outcomes is more marked the more deprived the population is. This is an interesting point. If you ask the layperson, what happens when you train more doctors? They will say, health services will get stronger. The interesting thing is it's not just the numbers that matter. Increased outcomes of better health come when you have more generalists, not more specialists. And with apologies to the specialists in the audience, I would just draw attention to the fact that higher numbers of specialists, not because of the specialists, but because of the setup and access, is associated with later detection of and worse outcomes in cancers, including colorectal, breast, uterine, cervical, and melanoma. This is a reflection of the advocacy role delivered through family physicians, the gatepost and signposting role that we can help with. Patients who present to a specialist first with an undifferentiated, let's say, abdominal pain, how do they know whether to go to an obstetrician, to a surgeon, a gastroenterologist, or a psychiatrist? How do they know? They need the specialist family medicine to advocate and to signpost them. Starfield showed a long time ago that too few true generalists and a surfeit of specialists, too many specialists, is bad for population health, bad for the economy, and even worse, for health equity. Of course, we do need specialists. This is not a generalist versus specialist argument. We need specialists wherever the diagnosis has been made and patients have been filtered, where discrete interventions are needed, where higher technological expertise is needed, and where conditions are rare, and therefore we in primary care might not see enough to maintain competence. So we have to work in balance, specialists and generalists together, of course, but across the sector, in healthcare to populations, in order to achieve universal health coverage, we need strong primary care. So what is it about primary care that's giving these differences? Why do you get these sometimes counterintuitive outcomes? Why is it that there are few years lost to suicide in countries with stronger primary care systems, for example? Well, it goes down to the essential primary care functions. Firstly, we are first contact. That avoids unnecessary specialist visits. I've told you that in our country, we manage 90% of what comes through our door. We offer persons-focused care over time, so that avoids disease-focused care, and that makes care more effective. It's related to the comprehensiveness of the services, which avoids referrals for common needs and makes care more efficient by freeing up our specialist colleagues to employ their specialist technical knowledge. But crucially, the role of primary care is to coordinate, to avoid duplication and conflicting interventions, which makes care less dangerous. We've all sat in our clinic and had a patient come back and being told by their, for example, cardiologist, you need to take a beta blocker. And we know they've also got asthma. And we have to balance the two multimorbidities. Plenty of specialists do that excellently, but first contact care can do it more universally. So the generalist is the coordinator of care, as you all know. Specialists are increasingly expert in ever-diminishing areas of expertise, and care can become fragmented. Barriers can grow between subspecialties, and healthcare systems become more inflexible. Generalists increase communication between and within specialties, and we can bring our wider perspective to the discussion of patient care. These are some of the features of strong primary care and strong family physicians that starts to explain why universal health coverage is more cost-effective when you have strong primary care. Some of you may have read this recent paper, very interesting meta-analysis and review of 118 peer-reviewed articles and the grey literature. And if you have a chance to read this, I recommend it to you. It talks specifically about achieving UHC in low and middle income countries and outlines the challenges. And I'm in my last 5 minutes going to read through some of the things that they've said. The challenges in low and middle income countries start with weak primary healthcare systems, lead on to challenges in building resilience when those healthcare systems are threatened, such as global pandemics, but also financial crashes. Healthcare financing is related to financial risk protection, but it's also related to the epidemiological and demographic challenge in low and middle income countries, the distribution of illness, and the resilience in terms of the underlying health and well-being of the population is a threat. There's also a challenge amongst the governance and leadership. So there are lessons for all of us, both clinicians and administrators, policymakers and change agents, to think about the provision of strong primary care. What can be done then? What in these 5 areas are some some answers. I don't pretend to have those answers, but I can see some areas that might be worth looking at. We need to increase family medicine in the undergraduate curricula. It's shocking in some countries that they don't even have the coverage that you have in your wonderful universities. Family medicine is still seen as a second-rate specialty and is not included in all undergraduate curriculums. That has to change for the reasons we've just seen. Otherwise, why will any of our youngsters want to enter and be part of this solution? We also need to increase postgraduate training in family medicine. There are many countries where MBBS doctors go straight into general practice. Sri Lanka is amongst the torch-bearing countries where you have an excellent development program for postgraduate trainees. We can think about investing in community clinics, incentivizing continuity of care. I mean, we've all got a Starbucks stamp on our loyalty card, right, for shopping at Starbucks for our coffee. Why don't we give patients a loyalty card that they have to stamp when they come back to us and incentivize that continuity of care? How about investing in community diagnostics? We don't need an MRI facility on every corner, but maybe we need ultrasound and near-patient testing more widely spread in general practice. And we need to think about reducing the asymmetry in the distribution of healthcare facilities. Low-income areas have low coverage of healthcare facilities, and richer, more affluent areas have higher coverage. It's the inverse care law in practice. How can we increase the resilience of health systems? This has to do with health worker numbers. But it also has to do with strengthening the supply chains to support infrastructure, buildings, technology, and consumables. All need to be integrated into thinking about health service provision. And then those of us working need to think about enhanced quality assurance, including of preventative care. We need to be auditing our services, doing quality improvement projects, looking at ways of building in expert resilience. Healthcare financing and financial risk protection is the fourth area. It needs to start with universal population identification and record keeping. One of the beauties of our healthcare system is that we have a registered list. That means that every patient has his own GP. He knows their GP. And that enables you to do all sorts of research on the demographics. And some of you that I've had the privilege of working with in my university in Worcester have done quality improvement projects while you've been with me, looking at how the registered list enables you to monitor and audit your service. Consider hypothecated, taxation-funded social security. So the social security income is ring-fenced for healthcare, especially for informal workers. You could think about independently funded contribution-based schemes, but I would argue that we should do that with caution. Public-private partnership is an important way forward with that, but the risk is the missing middle. People who are neither poor enough to access social security nor affluent enough to pay for an insurance-based system. The missing middle, those who are neither quite poor enough nor quite well off enough. We do need to think about the epidemiological and demographic challenge. We have a paradox that we still have a high burden of non-communicable diseases alongside persistent communicable diseases. We have maternal and child undernutrition, which underpins that inability to respond to new threats like infection. We need to think, when we think about epidemiology and demographics, about harnessing the expertise and training of public health colleagues. And it's such a pleasure that you've invited public health colleagues here tonight as well. This crucial partnership. Education, maternal literacy, sustainability, climate change are all areas that impact on health that resilient healthcare setups need, and which are not just due to the strength of the medical services. But finally, I want to talk about governance and leadership. All countries that thrive have visible, united primary care, family medicine leadership. You have elected a new leader who has expertise and interest. She has compassion and empathy, and she's a hard worker. You need to find a way of cloning Malkanthi and growing the family care leadership along with leaders who have gone before her and set up this great institution. Those leaders need to demonstrate probity and transparency in decision-making, but there also needs to be community and cross-sector involvement. Cross-sector, health and education, health and hygiene, health and public services. And it needs to be linked to public information and education so that patients start to advocate for themselves as well when they access services. So in conclusion, strong universal health coverage needs visible, united family medicine leadership, the start of which we're seeing here to celebrate today. We need a joined-up approach to public health and primary care, working together, not in competition. I believe we need increased capacity in education and training for family medicine and public health, both in undergraduate and postgraduate provision. And I believe that the increased numbers of creative faculty need to be remunerated and rewarded, recognized and celebrated, so that senior family medicine trainees can see those role models and become those role models themselves and act as change agents. It's been an enormous privilege to meet up again with old friends, to share a few thoughts with you today. Thank you so much for the invitation, and I think it's dinner time now. Thank you very much.
Well, thank you very much, ma'am, for sharing your knowledge and empowering us tonight, as well as it is indeed an honor to have you amongst us tonight. And moving on, ladies and gentlemen, we are having another momentous occasion at the inauguration. That is the launch of the newsletter and the website. The newsletter Anchor, Volume 1, Issue 1, will be presented to the dignitaries by our editor, Dr. Aruni De Silva. Madam, over to you. Thank you, Dr. Aruni. And as you know, with technology, the world has become a smaller place. And with a click of a button, we can just wander to any place we want. And just like that, we have our own website of Sri Lanka College of Specialist Family Physicians. And I would like to invite the following dignitaries to do the honors to launch the official website of our college. Ladies and gentlemen, starting off with His Lordship Chief Justice 𝓘𝓷𝓭𝓮𝓷𝓽 Jayasuriya, our chief guest today, Honorable Minister of Health Dr. Ramesh Pathirana, Honorable Minister of Education and Leader of the House of Parliament Dr. 𝓢𝓬𝓲𝓭𝓮𝓷𝓼, Honorable Vajira Abeyewardena, Member of Parliament Sri Lanka, Honorable Jayantha Veerasinghe, Member of Parliament Sri Lanka, Additional Secretary to Medical Services, Ministry of Health Dr. Sunil Dialvis, Director General of Health Services, Ministry of Health Dr. Asela Gunawardena, Professor K. Mohana, Professor of Value-Based Health Professions Education at University of Worcester, President, Sri Lanka College of Specialist Family Physicians, Dr. Malkanthi Galhena, Dr. Deepika Atigala, Senior Health Specialist, World Bank, Dr. Kumar Navaratne, Country Representative, Asian Development Bank.
Thank you. Professional excellence is something that we all strive for. But then there are the exceptional few whose dedicated contributions and outstanding individual service have led to significant advances in their chosen field and the medical field in general. The fellowship of the Sri Lanka College of Specialist Family Physicians is awarded to such eminent personages in recognition of a lifetime of commitment and the service rendered to the college and in the field of family medicine. The President and the Council of the college are honored to award fellowships in this year to the following personages: Professor K. Moana, Dr. 𝓟𝓻𝓮𝓼𝓲𝓭𝓮𝓷𝓽, Professor Nandini De Silva, Dr. Preethi Vijaygunawardena, Dr. Kanatha Pillai 𝓟𝓻𝓮𝓼𝓲𝓷, and to Professor Kumar Mendis.
And now I would like to invite Dr. 𝓘𝓷𝓪𝓭𝓾𝓬𝓷𝓪 to read the citation for the award of honorary fellowship of the Sri Lanka College of Specialist Family Physicians to Dr. Professor K. Moana.
Good evening, everybody. Madam President, members of the Council, and distinguished Chief Guest. It gives me a profound pleasure to give the citation for the Professor K. Moana, who is my teacher and trainer, who was served in an exemplary way, particularly in the field of family medicine as a clinician, teacher, researcher, and a role model. Professor K. Moana, FRCGP, MA, and doctorate in education, is a senior fellow of Higher Education Academy, a national teaching fellow, and honorary fellow of Academy of Medical Education, and the 2018 winner of the prestigious Robin Steele Award for excellence for her outstanding contribution towards GP training presented by the Royal College of General Practitioners. She qualified in her MBBS in 1988, MA in Medical Ethics in 1992, Diploma in Child Health in 1992 as well, MRCGP in 1993, and FRCGP in 2002. Postgraduate Diploma in Medical Education awarded by University of Dundee in 2007, and Doctorate in Education for the, from the Institute of Education, University of College of London in 2016. Currently, she is the Professor of Value-Based Healthcare Education at the University of Worcester, and MBBS Program Director and Admission Tutor of the newly established 3 counties medical schools at the University of Worcester as well. She is a partner and trainer at the Darwin Medical Practice, Lichfield. She also the chair of the Medical Education Committee at Doctors Worldwide. She is RCGP International Development Advisor for Cyprus and an editorial board member and co-editor for several primary care publications. Amongst all her previous mentioned responsibilities, she also involved in online training at Health Education England and supervision of PhD candidates. Professor Moana contributed par excellence in her previous position as a director of postgraduate medicine at Kiel University School of Medicine and co-editor of the Kiel Clinical Leadership Academy, the Associate Dean Assessment at the West Midland Deanery, External Development Advisor for RCGP West Bengal Diploma in Family Medicine, NICE National Collaboration Center for Women and Children's Health, National Quality Management Training Standards Committee of RCGP, National RCGP Council member, uh, and, uh, and she was chair of Royal College of General Practitioners of Faculty Board of Midland, RCGP. And she served as a senior lecturer at University of Staffordshire and founding director of Master in Medical Education. She was in the Midland Therapeutic Advisory Committee, an inaugural member of West Midland Multi-Center Research Ethics Committee. She was also served as a senior lecturer in general practice at University of Derby and tutor in biomedical ethics at University of Birmingham. She has authored and published 16 books with 4 more currently in the press. She has over 50 chapters and papers published to her credit up to date. She continued to extend her academic training further through certificate in safeguarding at Humanitarian Leadership Academy in 2020, International Assessment course in October 2019, Advanced Assessment course at St. George University of London, October 2013, Certificate in Research Training in Ethnography, Language and Communication at King's College London 2013, SEDA International Examiner Certificate in 2010, ASME Medical Leadership Certificate from Cumberland Lodge 2008, and Research Ethics Committee Certificate from King's College London in 1997. Today, Professor 𝓘𝓷𝓭𝓮𝓷𝓽 is honored with fellowship from the Sri Lanka College of Specialist Family Physicians in recognition of her exceptional contribution made to the advancement of family medicine. Madam President, may I present to you Professor 𝓘𝓷𝓭𝓮, Honorary Fellow of the Sri Lanka College of Specialist Family Physicians.
To our honorary fellowship, I cordially invite the President, accompanied by the past President, Dr. Lalantha Senaratne, and the Secretary of the College, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽.
A big round of applause, ladies and gentlemen. How often do we get to respect a teacher like this? And also a big round of applause to the yeoman service from Professor 𝓘𝓷𝓭𝓮 to the college.
Thank you very much. Next, the citation for the award of honorary fellowship of the Sri Lanka College of Specialist Family Physicians to Dr. 𝓘𝓷𝓭𝓮𝓷𝓽 will be read by Dr. Niroshini De Silva.
Good evening, Madam President, members of the Council and guests. It gives me great pleasure and honor to read the citation for Dr. 𝓟𝓻𝓮𝓼𝓲𝓭𝓮𝓷𝓽, who has had an exemplary career and served in an outstanding manner to the advancement of family medicine. Dr. 𝓟𝓻𝓮𝓼𝓲𝓭𝓮𝓷𝓽 was born on the 29th March 1951 and received his primary and secondary education at the St. Patrick's College in Jaffna. In 1971, he obtained a diploma in civil engineering from the University of Moratuwa, and later, in 1972, entered the Colombo University to commence his medical education. Following his graduation from medical school, he completed his internship at the Batticaloa District General Hospital in 1979 and worked as a senior house officer in several medical specialties in Batticaloa and Colombo General Teaching Hospital. He trained as a registrar in neurosurgery at the Colombo General Hospital from 1981 to 1983. Later, he moved to Hartfield General Hospital to work as a clinical assistant and later a senior house officer. He commenced his GP training in 1990 at the Barlow House Medical Centre in South Wales. Since 1994 until today, he worked as a family physician with special interest in surgical dermatology at 𝓘𝓷𝓭𝓾𝓬𝓷 Medical Centre with registered patient population in 3,700. He continued his postgraduate studies and qualified in the Diploma in Immediate Medical Care in 1989 and a certificate in Primary Care Skin Cancer Management in 2009 from the Royal Australian College of General Practitioners. He is proud fellow of the Royal College of Surgeons, Edinburgh, Royal Australian College of General Practitioners, Royal College of General Practitioners, and the College of General Practitioners in Sri Lanka. He holds membership in many prestigious professional bodies including Sri Lanka Medical Council, General Medical Council in UK, Australian Health Practitioner Regulation Authority, Local Medical Committee of Barking and Havering in UK, Associate Fellow of College of Emergency Medicine, UK, British Medical Association, BMA, Fellow of the Faculty of Pre-Hospital Care in UK, Medical Defence Union, Sri Lankan Acupuncture Foundation, member of the Royal College of Surgeons in London, licentiate of Royal College of Physicians in London, Association of Surgeons in Primary Care in UK, direct member of WANCA 2016 to 2019. Dr. 𝓘𝓷𝓭𝓮𝓷𝓽 is a keen teacher and has been involved in many teaching activities in the UK. He functions as an accredited trainer and examiner for undergraduates and final year medical students, and a trainer of postgraduate family medicine, MD trainees from Sri Lanka, and MSc candidate in family medicine from Barts and London School of Medicine. In Australia, he is actively involved as an OSCE examiner for FRACGP since 2015. Some of the presentations at various forums include Pitfalls in Dermatological Surgery in Primary Care, WANCA SAR 2016, Developing Family Medicine in Developing Countries, WANCA 2008, Academic Primary Centers in Sri Lanka, WANCA SAR 2006. Dr. 𝓘𝓚𝓮𝓷𝓽 possesses expertise for over 40 years in the profession with experience in general medicine, anesthetics, minor surgery, and managing healthcare teams. Today, Dr. 𝓟𝓻𝓮𝓼𝓲𝓭𝓮𝓷𝓽 has honored with a fellowship from the SLSP in recognition of his exceptional contribution made to the advancement of family medicine. Madam President, may I present to you Dr. 𝓟𝓻𝓮𝓼𝓲𝓭𝓮𝓷𝓽, Honorary Fellow of the Sri Lanka College of Specialist Family Physicians.
Ladies and gentlemen, I believe that Dr. 𝓟𝓻𝓮𝓼𝓲𝓭𝓮𝓷𝓽 deserves another round of applause for receiving the honorary fellowship from our college at the inauguration. Next, to read the citation for the award of honorary fellowship of the Sri Lanka College of Specialist Family Physicians to Dr. rather than Professor Nandini De Silva, I cordially invite Dr. Aruni De Silva.
Good evening, Madam President, members of the Council and guests. It is with great honor that I present the citation for Professor Nandini De Silva, who has dedicated her career and served in an outstanding manner to the advancement of family medicine in Sri Lanka. Nandini De Silva, ni Kahavita Mohotti Appuhamilage Nandini Pereira Abesekara, and had her schooling at Visakha Vidyalaya, Colombo. Having entered the Colombo Medical Faculty, she excelled in her studies, topping the batch with first-class honours in the 3rd MBBS examination and graduating with second-class honours at the final MBBS in 1968. Having worked in the General Hospital Colombo, she proceeded to UK in 1975 with her husband, Dr. S.P. De Silva, who was training in radiology. She worked part-time in the UK and did not pursue higher studies as she wanted to devote time to take care of her first child. Returning with her family to Sri Lanka in 1978, she worked in Colombo Medical Faculty as a lecturer in pathology until 1981, when she decided to take family medicine as her career choice. She had 2 children by then. Working as locum to a GP in Moratuwa, she passed the postgraduate diploma in family medicine in 1983 and became a full-time GP in Kalubowila the same year. She graduated MD Family Medicine and received board certification as a specialist in 1989. In 1993, Professor Nandini joined the Faculty of Medicine, University of Kelaniya as a lecturer in community medicine. In 1998, amid some opposition but having full support from the Dean, Professor Carlo Fonseca, and other influential faculty members, she pioneered the development of family medicine in the undergraduate curriculum until it became a separate department in the 𝓘𝓻𝓮 Medical Faculty. Professor Nandini De Silva was appointed to the first cadre chair in family medicine in Sri Lanka in 2000. Her innovations in teaching included communication skills training through videotape replay and student-patient encounters, and role plays and small group learning methods. She conducted family medicine lecture training workshops for GP teachers from the College of General Practitioners of Sri Lanka. In 2003, she was a keynote speaker at the Regional Scientific Group meeting by the WHO on a family medicine co-curriculum for South Asia, and an invited resource person at national workshops in Bangladesh and Myanmar to introduce family medicine to the undergraduate curriculum. At the PGIM, Professor Nandini De Silva served as chairperson of the Board of Study in Family Medicine and an examiner for the DFM conducted in India. Following a sabbatical in Monash University, Australia, Professor Nandini initiated the first distance education program at the PGIM for general practitioners to follow the DFM in 2001, which was later converted to the online mode. Her interest in distance learning culminated in her being appointed Vice Chancellor of the Opening University of Sri Lanka in 2006, becoming the first woman medical doctor to be appointed a Vice Chancellor in Sri Lanka. During her tenure as Vice Chancellor of the Open University of Sri Lanka, she directed 2 educational DVDs on communication skills and counseling skills for doctors in collaboration with the SLMA, and initiated an online CPT program for general practitioners in affiliation with Monash University. Later, medical students and postgraduate trainees benefited from her expertise in designing and delivering online lessons in Moodle during the COVID-19 pandemic, when face-to-face classes came to a standstill. While being an executive member of the Working Party of Education of WONCA, World Organization of Family Doctors, she co-authored the WONCA Global Standards for CPD for family doctors and was involved in developing global standards for postgraduate family medicine education. She has participated in 7 WONCA World Conferences and 5 regional conferences, jointly won the first prize award for the best research paper at the conference in Seoul, South Korea, and was awarded the prestigious fellowship of Wanka in 2018. The most valuable gift to Sri Lanka Family Medicine by Emeritus Professor Nandini De Silva was recent release of her book Lecture Notes in Family Medicine as a free e-book on the PGIM library website. This book, highly sought after by medical students, postgraduate trainees and family medicine teachers, now published online under a Creative Commons license, allows medical professionals and students worldwide to access this invaluable resource for free and share it with others. Her other publications include the book on communication skills and counseling skills for doctors, chapters in books, and many articles in national and international medical journals. Professor Nandini's latest publication is the article titled Narrative Medicine in the Art of Healing in Clinical Practice, occupying pride of place as the leading article in the current issue of Ceylon Medical Journal. Professor Nandini De Silva is a fellow and a past president of the College of General Practitioners of Sri Lanka and has worked hard towards the academic advancement of family medicine. Her contributions have been recognized through numerous awards, including the A.M. Fernando Award, M.P.M. Curre Gold Medal for the College Oration, and Felicitation Award for Academic Excellence from the College of GP Sri Lanka, Zonta Woman of Achievement Award for Medicine, and the Honorary Fellowship of the Royal College of General Practitioners. On retiring from the University of Kelaniya in year 2009, she was conferred the title of Emeritus Professor. Although fully retired, she continues academic work as the chairperson of the Curriculum Review and Development Committee of the MCGP Diploma of the College of GPs. She is happy and contented in her retirement, spending time with her family while continuing to enjoy her favorite pastime, singing with the Saturday Singers. Today, Professor Nandini De Silva is honored with a fellowship from the Sri Lanka College of Specialist Family Physicians in recognition for her exceptional contributions made to the advancement of family medicine. Madam President, may I present to you Professor Nandini De Silva, Honorary Fellow of the Sri Lanka College of Specialist Family Physicians.
Dear Madam, I request you to come forth and together with past President Dr. Lalantha Senaratne and the Secretary of the College, Dr. 𝓘𝓷𝓭𝓾𝓬𝓷𝓽.
Next, I would like to call upon Dr. 𝓘𝓷𝓭𝓮𝓷𝓽 to read on the citations of Dr. Preeti Vijayagunawardena.
Good evening, everyone. Madam President, members of Council and guests. It gives me immense pleasure to read the citation for Dr. Preeti Vijayagunawardena, who has had an exemplary career in and served as an outstanding manner to the advancement of family medicine. Dr. Preeti Vijayagunawardena is a well-known senior family physician in Colombo for nearly 40 years. He was past president of Sri Lanka Medical Association in the year of 2002. He has been involved in teaching family medicine to the undergraduates of Colombo, Kelaniya and Sri Jayewardenepura medical faculties as a visiting lecturer in their extended faculties since early 90s, and also a visiting lecturer in family medicine at the Postgraduate Institute of Medicine of University of Colombo for many years. He has been examiner for the Diploma in Family Medicine in Colombo and India, MCGP exam of the College of General Practitioners of Sri Lanka, and MRCGP International South Asia exam since 2007. Dr. Preeti Vijayagunawardena was a past president of College of General Practitioners from 2004 to 2007. He was the president of World Organization of Family Doctors South Asia from 2007 to 2013. He was awarded a Fellow of WONCA in October 2016, the highest honor given to a member in recognition of the services to WONCA and the world in the field of family medicine. He is a recipient of honorary fellowship of the Royal College of General Practitioners, UK in 2009. The honorary fellowship of the Bangladesh Academy of Family Physicians in 2018, and a lifetime award for leadership of the College of General Practitioners of Sri Lanka in 2009. Dr. Preeti was awarded with title of International President of Royal College of GPs in UK in 2021, which is awarded to GP leaders who given their best to the community as GPs in their own country and the region. He is currently the chair of MRCGP International South Asia Board and MCGP Sri Lanka Board. Dr. 𝓘𝓷𝓭𝓮𝓷𝓼 is an honorary member of the Pakistan College of Family Medicine and an honorary fellow in Indian Medical Association College of General Practitioners. He worked closely with WHO Southeast Asia region to bring about the changes in the quality of family doctors during his tenure as WONCA South Asia President, and to change the mindset of the policymakers and health planners of South Asia to make it possible for the GPs to be recognized as a pivot in the primary health care team of the country. His effort changes the views of governments, health planners, universities, and all stakeholders in accepting family medicine as a specialty and recognizing the role of the GP as a key player in the primary health care. He has delivered many guest lectures and orations locally and internationally. Besides his commitment to serve the community in his practice locally as a family doctor, his passion in teaching undergraduates and postgraduates in family medicine. Today, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽 is honored with the fellowship of the Sri Lanka College of Specialist Family Physicians in recognition of his exceptional contribution made to the advancement of family medicine. Dear Madam President, may I present you Dr. 𝓘𝓷𝓭𝓮𝓷𝓼, Honorary Fellow of the Sri Lankan College of Specialist Family Physicians.
The night is still young and there are 2 more fellowships to be awarded. And let's take a small break for a little entertainment. We have 𝓟𝓻𝓮𝓷𝓽 and the clan.
වසනතුරු නිවන් දකින්නතුරු සසර වසනතුරු නිවන් දකින්නතුරු පින් කෙත හෙළරන් දෙරේ යලි උපදින්නට हेतु वासना देवा हेतु वासना රත්නමාලි සෑකිරණයි මහබෝ සෙවනයි තිසාවවයි සීගිරියයි මගේ උරුමයයි රත්නමාලි සෑකිරණයි මහබෝ සෙවනයි තිසාවවයි සීගිරියයි මගේ උරුමයයි සසර වසනතුරු නිවන් දකිනතුරු සසර වසනතුරු නිවන් දකිනතුරු පින්කෙත හෙළරන්දරේ යලි උපදින්නට හේතු වාසනා වේවා හේතු වාසනා සසර වසනතුරු නිවන් දකිනතුරු සසර වසනතුරු නිවන් දකිනතුරු පින්කෙත හෙළරන්දරේ යලි උපදින්නට හේතු වාසනා වේවා හේතු වාසනා
Ladies and gentlemen, that was 𝓟𝓻𝓮𝓷𝓽 and his dance troupe. Well, moving on once again to the ceremonial official proceedings to continue with the awarding of honorary fellowships. Next, to read the citation for the award of honorary fellowship of the Sri Lanka College of Specialist Family Physicians to Dr. Kanapati Pillai 𝓢𝓬𝓲𝓭𝓮𝓷𝓬. I cordially invite Dr. Asela Anthony to read the citation.
Good evening. Dear Madam President, members of the Council and guests. I am privileged and honored to present the citation of my dear teacher, Dr. Kanapati Pillai 𝓢𝓬𝓲𝓭𝓮, a renowned senior general practitioner who has served as a dedicated clinician, teacher, and an inspirational mentor. Dr. 𝓢𝓬𝓲𝓭𝓮 is a proud alumni of the Colombo Medical of the Faculty of Medicine, University of Colombo, to which he enrolled in 1973. Since his early years as a medical professional, he has developed a keen interest and passion towards family practice, which paved the path for him to become a dedicated general practitioner. In the year 1981, he became a member of the College of General Practitioners of Sri Lanka. Today, he is one of the very senior and much sought out GPs in Sri Lanka. Currently, he is the chair and the clinical director of Ave Maria Hospital in Negombo. He is the current president of Wonka South Asia region, in which he has served in numerous capacities in the past. He is a past president of the College of GPs, College of General Practitioners of Sri Lanka, and has held many positions in the college, including secretary, chair to the research committee, and the faculty of teachers of family medicine. He is a devoted teacher and has contributed to shaping many generations of young doctors. He has instilled his wealth of knowledge to clinical undergraduates of University of Galhena and postgraduate trainees in family medicine from PJM Colombo in the capacity of visiting lecturer, clinical trainer, examiner, and a certified online teacher. He is also one of the very senior examiners for the MRCGP International South Asia exam. He has served as a board member of Board of Study in Family Medicine, Postgraduate Institute of Medicine, MRCGP International South Asia Board, MCGP Board, College of General Practitioners of Sri Lanka. During his long career, Dr. 𝓢𝓬𝓲𝓭𝓮 has obtained many academic qualifications apart from his diploma in family medicine. He is a certified member of the Accounts of Australia and New Zealand, has a master's in business administration. He also possesses a postgraduate diploma in child health, postgraduate diploma in family medicine, and a postgraduate certificate and diploma in medical education. He is the recipient of many honorary fellowships, which include Fellow of Wonka, Fellow of RCGP UK, Life Fellow of Royal Society of Medicine UK, Fellow of the Royal Society of Public Health UK, Fellow of College of General Practitioners of Sri Lanka, Fellow of Certified Professional Managers of Sri Lanka, Fellow of the Society of Family Medicine in Pakistan. He was the recipient of many awards conferred by prestigious bodies. He received the Lifetime Achievement Award for his contribution towards the development of family medicine in South Asia region and the Wonka South Asia region 5-star Doctor Award. A Lifetime Achievement Award for the contribution to the community by YMCA. Service Above Self Award by the Rotary International for services to humanity. And American Ambassador Award for medical excellence. These are few of his achievements and awards that he has received. Today, Dr. Kanapati Pillai 𝓟𝓻𝓮 is honored with the fellowship from the Sri Lanka College of Specialist Family Physicians for his lifetime service and notable contribution made to the advancement of family medicine in Sri Lanka. Dear Madam President, may I present to you Dr. Kanapati Pillai 𝓟𝓻𝓮, Honorary Fellow of the College of Sri Lanka College of Specialist Family Physicians.
Madam, I cordially invite the Secretary of the College to accompany our President, Madam Malkanthi, together, and also the past President, Dr. Lalantha Senaratne, to come forth to hand over the awarding of honorary fellowship. Thank you very much, ma'am, and congratulations, sir. Moving on with the awarding of honorary fellowships, to read out the next citation for the award of honorary fellowship of the Sri Lanka College of Specialist Family Physicians to Professor Kumar Mendis, I cordially invite Dr. 𝓘𝓷𝓭𝓮𝓷𝓽.
Good evening. Nothing to worry, this is the last citation. Madam President, Member of the Council, and Honorable Guest, it gives me immense pleasure to give a citation for Professor Kumar Mendis, who has been selected to receive an honorary fellowship from the Sri Lanka College of Specialist Family Physicians in recognition of the outstanding contribution he has made in the field of family medicine. Professor Kumar Mendis is a medical professional with extensive experience over 3 decades as a clinician, researcher, and an academic in family medicine with added qualification and experience in medical informatics in Sri Lanka, Australia, and UK. He has contributed his skills in designing and managing coursework with learning management systems in the field of primary care, family medicine, biomedical informatics, and evidence-based medicine. His expertise in these fields led him to network internationally through collaboration with the WHO, Wonka, and several universities in Australia and UK. Professor Mendis obtained his MBBS in 1980 from the University of Colombo. Later, he qualified in the Diploma in Family Medicine in 1991 and moved to the Netherlands Institute of Health Science at the Erasmus University in the year 2000 to pursue an MSc in medical informatics. Upon arrival to Sri Lanka, he received his MD in family medicine in 2002 from the Postgraduate Institute of Medicine, University of Colombo. Currently, he is a Carter Chair and Professor of Family Medicine at the Faculty of Medicine, University of Galhena, a conjoint associate professor at the School of Medicine, Western Sydney University, Australia, and a PGM trainer in family medicine. Professor Mendis has also served in the capacities of Associate Professor, Rural Health and Research, Bathurst Rural Clinical School, School of Medicine, Western Sydney University, Australia. Senior Lecturer, Rural Health, School of Rural Health, Sydney Medical Schools, University of Sydney. General Practitioner, Narrowmind Share Family Practice, Narrowmind, Australia. Senior Lecturer, Community Medicine, School of Rural Health, Faculty of Medicine, University of Sydney. Senior Lecturer, Department Community and Family Medicine, University of Kelowna. Head, Computer Center, Faculty of Medicine, University of Kelowna. Lecturer, Department Community and Family Medicine, University of Kelowna. And Panel Physician, 𝓟𝓻𝓮𝓷𝓼 Airlines. He has held membership and worked in the various boards and committees in many prestigious local institutions, including PGIM, University of Kelowna, Sri Lanka Medical Association, Sri Lanka Medical Council, Sri Lanka Medical Library, Ceylon College of General Practice in Sri Lanka, and Health Informatics and Society of Sri Lanka. WHO, WANCA, Australian Institute of Digital Health, Australian College of Health Informatics, Royal Australian College of General Practitioners, Australian Health Practitioner Regulation Agency, and New South Wales Medical Registration Board are a few international bodies where he was a member. Professor Mendy is a keen researcher and has led many teams in pioneering research studies in family medicine and medical informatics. He has published over 100 manuscripts in the form of full research papers, books and journal articles, and made presentations at various forums. Today, Professor Kumara Mendis is honored with a fellowship from the Sri Lanka College of Specialist Family Physicians for his exceptional contribution made to the advancements of family medicine in Sri Lanka. Madam President, may I present to you Professor Kumara Mendis, Honorary Fellow of the Sri Lankan College of Specialist Family Physicians.
To accompany the President, I cordially invite the past President, Dr. Lalantha Senaratne, and also the Secretary of the College, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽. Congratulations, sir, and thank you very much, Madam President, past President, and the Secretary. Well, that was a momentous occasion as well for our 6 honorary fellowship recipients, Professor K. Mohana, Dr. Saranamuthu Puloganadan, Professor Nandini De Silva, Dr. ADPA Vijay Gunawardana, Dr. Kanapati Pillai 𝓟𝓻𝓮𝓷𝓼, and Professor Kumara Mendis. Congratulations, ladies and gentlemen. And next we are moving on to another entertainment act. We have a young talent, young star amongst us who has come from Voice Teen, and she has produced her own songs, and a popular singer. That's none other than Aditya Valivatta is here to entertain us. Ladies and gentlemen, she'll be singing with the band, so do bear us, because technology takes some time. Though it's a small world, though we said a lot of things, still technology takes a little time.
Us
Ladies and gentlemen, Aditya Valivatta. Right, thank you, Aditya, for entertaining us and also the whole of Sri Lanka. Next, we are moving on to another important occasion that is, well, the day is almost in, but all good things must come to an end. But this tonight is a landmark of many glorious milestones for Sri Lankan primary healthcare. So moving on, I now invite the Secretary of the College to propose the vote of thanks. Dr. 𝓘𝓷𝓭𝓮𝓷𝓽, sir, over to you.
His Lordship, Chief Justice 𝓘𝓷 Jayasurya, Honorable Chief Guest, Dr. Ramesh Pathirana, Guest of Honor, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽, Special Guest Honorable Minister Dr. 𝓢𝓬𝓲𝓭𝓮𝓷𝓬, Honorable Jayantha Veerasinghe, Honorable Vajira Abeyawardena, Professor K. Mohana, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽, and ladies and gentlemen. It is indeed my privilege to deliver a vote of thanks on behalf of the Council and members of the Sri Lanka College of Specialist Family Physicians on this momentous occasion of the presidential induction and inauguration of the scientific sessions. First and foremost, I extend my heartfelt thanks to our chief guest, Dr. Ramesh Pathirana, Minister of Health Services and Industries. Your presence today is an honor to all of us, and your insights have added great value to this ceremony. I would like to convey our special thanks to our guest of honor, Dr. Deepika Artigala, Health Specialist at the World Bank. We are grateful for you, your valuable contribution and your time. My heartfelt thanks to His Lordship, Chief Justice Jayantha Jayasurya, Special Guest Honorable Minister Dr. 𝓢𝓬𝓲𝓭𝓮𝓷𝓽, Minister of Higher Education and the Leader of the House of Parliament Sri Lanka, Honorable Jayantha Veerasinghe, Member of the Parliament Sri Lanka, Honorable Vajira Abeyawardena, Member of the Parliament Sri Lanka and former Minister, for gracing us with their presence. I would also like to extend my warmest appreciation and thanks to our special guests, Professor K. Mohana, International Advisor for Primary Care at Royal College of General Practitioners, UK, and Dr. Raman Kumar, Founder President of the Academy of Family Physicians in India. Your global insights have broadened our horizons, and we are indeed honored your participation. I would also like to take this opportunity to extend special thanks to all the resource persons who have contributed their time and knowledge to make this event a success. Our gratitude extends to honorary presidents and colleagues from other academic colleges, Dr. 𝓘𝓷𝓭𝓮𝓷𝓽, Director General of Health Services, and officials from the Ministry of Health, Dr. Darshan Sirisena and Dr. Haritha Alodge from GMOA, and Dr. Mrs. Dilipa Amarasuriya from AMS. Your presence here today demonstrates the strong partnership between our college and the health authorities. We hope to work together with you in the future. An event of this caliber would not have been possible if not for the hard work and commitment of all the chairpersons and members of the committees involved. I want to commend the organizing committee led by Dr. Malkanthi Galhena, President, Sri Lanka College of Consultant Family Physicians, for their meticulous planning and execution. The scientific committee led by Dr. Lalantha Senaratne, the founder president of our college. And last but not the least, the financial committee for unwavering supports, and without whom this event would not have been possible. I express our gratitude to sponsors whose support was very crucial in making this event possible. I would like to extend my thanks to event organizers for the coordination and job well done, the hotel staff of Cinnamon Lakeside for their hospitality, support, and service, and everyone who worked tirelessly behind the scenes. And special thank you to each and everyone who I haven't mentioned here who have contributed towards the making of this event. Last but not the least, I extend my thanks to all attendees. Your presence have made this event vibrant and enriching. As we bring this ceremony to a close, ladies and gentlemen, I invite everyone for the best part of this evening to join us with cocktail and dinner. Wish you a pleasant evening, and again, I want to thank you for making this day a memorable one.
Ladies and gentlemen, with that, we conclude the inauguration ceremony of the inaugural scientific sessions of the Sri Lanka College of Specialist Family Physicians. While thanking you for your kind attention, gracious presence, we kindly now request you to remain stand for the ceremonial procession to leave the hall.
The parade of the Temple of the Tooth. The world watches in awe as the tooth relic of the Lord Buddha is placed in a golden casket and is mounted on the chief elephant's back as he strides through the city with pride to the rhythm of beating drums. Presented to you by the best of Sri Lankan talent, 𝓟𝓻𝓮𝓷𝓽 Performing Arts Foundation.
buhay.